Hello, everyone. Thank you for being here and welcome. I'm Danielle Vaccaro, a 30-year-old diagnosed with classical-like Ehlers-Danlos syndrome. Diagnosed in May of 2021 with EDS has drastically changed my life. For years on end, I had suffered from ongoing pain and symptoms that were impacting my life daily. Some of my first symptoms, joint pain, headaches, and dizziness, started as young as elementary school and worsened over the years. Pediatricians used to refer to this pain as growing pains. I was even granted a second snack time in elementary school, as no doctors could pinpoint the reason for my dizziness. Since I was dismissed for so long, I became an expert at masking my pain. I soon convinced myself that everyone must be in pain, just like myself. Fast forward to my college years, I noticed my fatigue was worsening, and my ability to complete daily school assignments became increasingly more difficult. With a passion for movement, I pursued a degree in exercise physiology. At that time, I embarked on my own strength training journey, as well as my personal yoga practice. As someone who could relate to others in pain, I decided to apply for a therapeutic yoga teacher training. It was during my intensive 23-day, 200-hour yoga training in July of 2016 that I realized all of my current symptoms were concerningly not normal. My joint pain was at an all-time high, and my legs would become numb and tingle anytime I did some sort of seated meditation, which we began each day with. Nonetheless, these were some of my best memories despite the pain. Throughout the years of 2017 to 2020, my symptoms became more debilitating. I went from doctor to doctor with no answers, and them often blaming my symptoms on anxiety. In February of 21, I underwent a laparoscopic excision surgery for endometriosis in hopes that I would feel relief from a lot of my everyday pain. After this high-stress event, my symptoms were only exacerbated. I realized my incisions took a lot longer to heal than anticipated. I developed a few hematomas, and my neck and upper traps were in excruciating pain for months afterwards. While I was home recovering, I dove deep into my own research. I had come across the term EDS a few times on Instagram as I was publicly sharing about my recovery from endometriosis surgery. Now that I had time to read more about it, there wasn't a question in my mind that I was also experiencing a connective tissue disorder in addition to endometriosis that was the culprit of my pain. Due to no confirmed family history, I was turned away quite a number of times from rheumatologists, primary care physicians, and geneticists. This journey was extremely lonely and traumatizing at the time. When I finally found an EDS-aware physician who listened to me, believed in my suspicion, took my medical health history, performed a clinical exam, including the Beighton scale, and sent in a genetic panel, I was officially diagnosed in May of 2021. About a month later, another EDS-aware physician asked questions regarding possibilities of comorbidities. At the time, I wasn't experiencing, he had asked if I ever experienced anaphylaxis. At the time, I wasn't experiencing anaphylaxis. However, I did have certain sensitivities to many products, including makeup. I remember feeling sick at each dance recital through the years and not realizing that this could be related to histamine issues. At a young age, this was the only time I was wearing makeup, and I would often react by forming a sty in my eye and experiencing teary eyes with a runny nose and a bad headache that felt like a head cold. For years, I remember I couldn't figure out why this was happening to me. I would have conversations with friends, and nobody seemed to be in the same position. As my abnormality list was growing longer, I had to more closely investigate and continue advocating. I soon learned that only a small percentage of those with mast cell activation syndrome experience anaphylaxis. Perhaps at the time, perhaps for a patient, more important for a specialist to mention to a patient, if at the time the patient is not experiencing anaphylaxis, would be, have you ever had occurrences of allergy-like symptoms such as rashes, hives, flushing, low blood pressure, and/or difficulty breathing that could not be pinpointed to a specific trigger? With EDS often comes many common comorbidities, so I will spare you of the longer list, but these are just a few of my other conditions. Mast cell activation syndrome affects individuals very differently, but for me, it most greatly impacts my skin. As I mentioned earlier, my ongoing reactions to makeup were my first symptoms related to mast cell. Next, my skin started developing rashes in reaction to the heat, humidity, sunlight, and UV. The dermatologist had misdiagnosed me with different conditions, and none of the body washes or medications seemed to help. I've had one specialist recently confirm with me that this rash is very evident of chronic spontaneous urticaria, often seen with mast cell. I'm finally seeing an allergist and immunologist that specializes in mast cell this upcoming February. My first life-threatening flare-up of mast cell activation syndrome was in September of 21. My symptoms had started with a hoarse voice and a sore throat. At the time, the symptoms started progressing for about a week, and then I went to urgent care to rule out strep throat and other bacterial issues. They sent me home with no answers other than to follow up with a doctor. A few days later, my symptoms soon progressed to a closing of my throat, making it extremely difficult to talk and to swallow, not only food, but also water. About 4 days later, with the additional stress of feeling like my airway was closing, I went to the emergency department. Unfortunately, I left there with no answers as they were able to rule out everything they had tested for. They did tell me to follow up with an ENT, so I eventually made my way to an ENT who just noted some acid reflux. Later, wanting to look deeper into mast cell activation, I booked my first appointment with an allergist and immunologist. Despite my negative workup for tryptase and histamine in March of 2022, I have since experienced additional episodes of the closing of my throat. This is unfortunately a reality for many individuals living with mast cell activation syndrome. For those that are familiar with Diagnostic Odysseys, as I'm sure a majority of you in the audience are, everything is normal is not something we want to hear. With these negative test results, I find some medical professionals are more likely to dismiss our symptoms instead of listening to our concerns, especially when these symptoms are invisible. I believe I have found my true purpose and passion in life to continue sharing my stories so that we can raise awareness of EDS and comorbidities like mast cell activation syndrome. The more we are able to continue advocating, the more hope we have that the journey to a diagnosis is a lot less traumatizing for future generations. Here is to more advocacy and awareness, eventually amounting to positive change in the Diagnostic Odyssey for those who come after us. Thank you for having me and allowing me to share my story.